Welcome. Let's talk about bloating and flatulence while on CPAP. Consider this scenario. A patient was recently started on CPAP and now complains of bloating, gassy distension, or flatulence following the use of CPAP in the morning or even during CPAP use in the middle of the night. Now, there may be many reasons for it. The first reason is to consider that the CPAP pressures may be excessive, especially when the patients are lying on their sides or in non-REM sleep. Usually, CPAP is titrated to the highest pressure required to abolish obstructive sleep apneic episodes. Now, this highest pressure usually occurs when the patient's supine or the patient's in REM sleep. So when they're in REM and supine sleep, the pressure required may be higher. However, when they go in a lateral position or even in non-REM sleep, the pressures may be excessive and then transmitted to the esophagus during the transition from one sleep phase to another. The second issue could be a difference in head or bed elevation. If the number of pillows used at home compared to the number of pillows used at this sleep study lab are significantly different, this may also change the amount of pressure required by the patient. The next thing is probably the most obvious thing is the pressure setting, is to double check the pressure settings as are adequate and as ordered by the physician reading the sleep study. This can easily be attained by looking at the compliance data downloaded from the machine, or even have the patient bring in the machine to the DME company or even to your clinic. The next thing is considering weight loss as a cause for bloating and flatulence. If the patients had a significant amount of weight loss, usually in the order of more than 10% of their weight from the sleep study, the patient's pressure requirements may have decreased. Hence, the higher pressures may cause bloating and flatulence. Now, what are some of the solutions to this problem? One of it, and which is a common solution now being employed, is by using EPR or C-Flex. C-Flex or EPR helps drop the expiratory pressure between 1 to 3 centimeters of water depending on the setting. This reduction in pressure is thought to reduce the likelihood of feeling smothered and even gastric distension. If a patient has a self-adjusting machine or an auto-PAP machine, automatic positive airway pressure, then consider widening the pressure gradient from 4 to 20 centimeters of water, which allows the machine to auto-titrate the pressure up, especially if the patient's in supine and REM sleep, as opposed to non-REM and lateral sleep, where the pressure requirements may decrease and the machine may automatically titrate that down. It's extremely important as well, once any pressure adjustments are made, is to check the download data in 30 days to assess that the AHI is still less than 5, hence allowing you to make the pressure change without worrying about worsening in obstructive sleep apneic episodes. Now, if the patient has an older machine, usually older than 5 years, most insurance companies will pay for the upgrade to a newer auto-PAP machine. The next option is to repeat an in-lab study. So an in-lab study would be required especially if the patients lost more than 10% of their weight, plus if they had a home sleep study and was started on auto-PAP directly. There may be an underlying other sleep conditions which may need to be evaluated as well. So an repeat titration in an in-lab setting may be warranted in this case. If all else fails, go back to using the auto-PAP at 4 to 20, but increasing the head or bed elevation. Now, this can be done, like I said, using a wedge pillow, not just increasing the angle between the neck and the head, but increasing the elevation of the torso upwards. And if all else fails, a GI consult may be required in the setting, especially if it's suspected that the patient has a primary GI issue. Thank you.